Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. On the program, for many of you who have listened to us over the years, you know that we'd like to talk about unique and natural approaches to how a person can heal from all sorts of ailments, from the common cold to something as severe as cancer. And although we are not professionals, I'm just simply a broadcaster bringing information. It is our intention on this program to open doors and show opportunities where perhaps a person may not have seen that before. It's getting good information out there, and information that actually gets people to begin to ask questions and take a more proactive role in what it is and what it takes for a person to heal. Joining us here on the Beyond 50 radio program is a guest that we've had on our program before, and that is many times what we have talked about here today. He graduated with first-class honors degree in molecular biology and biochemistry, and then graduated from Boucher Institute of Naturopathic Medicine as a naturopathic doctor. He currently practices at Yaletown Naturopathic Clinic in Vancouver, British Columbia, where the main focus is on integrative oncology, and that is to say, it's a way of looking at how we can treat and perhaps even prevent cancer. And that's one of those elusive things that many people out there doing, race for the cure, run for the cure, you name it. There's a whole industry out there of people raising millions of dollars year after year to try to find ways that we can combat this awful disease. I'd like to welcome to the Beyond 50 radio program today our guest, author of the book Integrative Cancer Care. It's the power of being informed. Dr. Adam McLeod joins us here on the Beyond 50 radio program. Dr. McLeod, thank you for joining us today.
Thanks for having me on.
Now, it's pretty exciting about your life path and how you came to actually become interested in the healing arts. Kind of give our audience a background, as we've had you on the program before, about how this all started for you.
Yeah, it's kind of an interesting story. I mean, initially what happened was I was actually drawn into energy healing after a spontaneous healing event occurred between myself and my bedridden mother. And she's had MS since I was very young, and many of my memories of her as a child are her struggling to do everyday family activities. And one day she was having a trigeminal neuralgia attack. It's a stabbing pain across the side of the face. And for whatever reason, honestly, looking back on this day, I can't even tell you why I did this. But I went up to her room, and I put my hand over her head. And I immediately went into this very deep trance, and I couldn't see anything else around me except for these vivid images of my mother in front of me. And it very, very literally felt like I was navigating throughout her head. And when I changed the energy that I was seeing in front of me, her pain went away. And to this day, she never got another pain. Mm-hmm. And this was such a phenomenal experience. It was just a life-changing experience that it really sparked my scientific curiosity, and it motivated me to share these experiences with the world. And, over the last few years, I've been, I've done a lot of research on this. I went into the field of molecular biology and biochemistry to understand the mechanisms as to how life works and how does energy interact with a complex biological system. And the more that I learned about it, the more that I realized just how powerful of an impact our intentions have on our health. And the research on it is actually incredibly solid. There's a lot of very strong research on this. It's just that the mechanism isn't fully understood. Mm-hmm. And so we have this visceral response to kind of disregard things if we don't understand how it works. But the reality is that there's no question about this, is that a positive, focused patient who's directing their energy towards healing is going to be doing better than someone who is not. Mm-hmm. And just given that information alone, this is something that every patient should be encouraged to do.
Well, there's no doubt about that. And the first thing to touch on, too, is when you take a look at the whole thing, I think sometimes in America that we tend to separate things into individual components and try to get a deeper understanding of that individuality rather than really pull back and look at the thing as a whole. For instance, just like, the human body and how it works. Well, here's the heart responsible for circulation. The lungs are responsible for, of course, oxygen and getting the body to breathe, and it goes on, but then you realize, but as an integrative whole, each one can't exist without the other, sort of the gestalt, effect, so to speak. But a lot of times when it comes to, let's say, energetic healing, a lot of times in the mainstream medical community, they would tend to push that off as sort of, well, that's mystical witch doctor stuff. You know, I'm a trained doctor, for instance. This is the way it's been done. This is what I believe in, and it goes on and on. And when you take a look at, for instance, how you've become accredited and degreed and, of course, certified as a naturopathic doctor, that same sort of attitude seems to be there as well. You know, a naturopathic doctor, well, those aren't real doctors, you know, and you hear this even from people as well. But what I'd like you to do, first of all, is to share with the audience what is the difference and the similarities between the training of a naturopathic doctor and a regular mainstream medical doctor.
Well, yeah, a lot of people don't even realize this, that naturopathic doctors are incredibly qualified. And, you know, in order to get into the program in the first place, you need to have a degree. Not only that, you need to have a degree with good marks, very similar to any medical school. And we go through 4 years of medical school, and when you look at the core curriculum of naturopathic medicine, it's actually very similar in a lot of ways to a traditional medical doctor. In fact, there's so much overlap with the material that when many of us are studying for our board exams, we actually study from the USMLE. We study from the medical doctor's board exams when we're getting ready for our board exams. That's how much overlap there is with the material there. We're doing the same, you know, biochemistry, pharmacology, depending on which province or state you're in. You know, in my province, for example, I can tell you that naturopathic doctors, we have the right to prescribe medications. We can do minor surgery. We can order lab tests. I mean, there's a very wide scope of what we can do. And what I really love about naturopathic medicine is how large our toolbox is. There's so many different things that we can do. If needed, I can write a prescription for conventional medication for that patient. But I can also suggest that the patient do these different natural approaches to work in conjunction with that. Or we can try the natural approaches first, and if that doesn't work, we can then go with a prescription. I mean, we can really customize these plans to build a real synergistic plan that works well for that unique individual. And that's something that more people need to realize, is that, you know, there's kind of this perception that naturopathic medicine is not evidence-based. And the reality is that that couldn't be further from the truth. Naturopathic medicine is very evidence-based. And when you look at my latest book, Integrative Cancer Care, there are literally hundreds of references in there of, you know, about these different therapies and how they can be used in an integrative cancer setting. And really, there isn't any debate about this. The only debate that's stimulated around these things are people who didn't read the research. The research is very consistent.
You know, and it's pretty interesting, too, how people will go out to glean information out there, and let's just say in the world of looking how to prevent, perhaps treat cancer. And, you know, nowadays they have the Internet. And all of a sudden, you know, everybody's an expert out there, you know, with really no credentiality or anything whatsoever. And the one thing that you make clear in this book is, look, you really should be involved in a professional, especially when it comes to something as serious as cancer, for instance. Now, the first thing is that what was interesting about what you said right away is, although you have this particular, I guess, gift, if you will, of being able to see, understand, perceive, and even heal with energy, you even admitted that it came to a point where, you know, that just wasn't enough. There needed to be more. Tell us how you came to that particular realization.
Well, when I was first experimenting with energy, I was only 16 years old, and so there really wasn't.
Come on, most guys are trying to get their first car and go out on a date.
Yeah, so you know, I was still in high school. I was a kid, and really, the different options that were available for me to use, it was really just energy healing. That was the only thing that I was qualified to do. It was the only thing that I could do. And as I started to learn more about you know, molecular biology, and then eventually going down the path of medicine here, I have more tools that I can now use. And I find that where patients do best is when they use all these things together. You know, the ideal treatment plan is never just one thing. It's always combining all these different therapies that really resonate with that patient to develop a customized treatment plan for that individual. And in my practice, you know, I very often obviously focus on a lot of the physical things that are going on. We have to make sure that the patient's adequately supported through chemotherapy or radiation or whatever therapy they're doing. But at the same time, if it really resonates with a person, if energy healing is something that resonates with that person and they feel that that's something that's going to be making a difference with them, then I will absolutely include that in the treatment plan. But I think that one thing that I use quite a bit, and it's really difficult to kind of articulate this and define precisely how I do this. But very often when I am talking with a patient, when I'm doing just a simple intake with a patient where I'm going through their case history, I will use my intuition to guide me to which questions that I'm asking. I'll be drawn to asking about a particular system or about a particular symptom that the person's having, and I really feel that my intuition guides me in kind of getting the overall picture about what's going on with that patient. And that reminds me of one other thing, Daniel, that I should mention about a key difference between naturopathic doctors and medical doctors is that naturopathic doctors take the time to go through the entire case history of the patient. We're not just looking at the symptom, we're looking at the entire patient, and we're trying to get to the root cause of the problem. And the reality is that if you talk with a patient for 5 minutes, you're never going to really get to the root cause of the problem, and you're certainly not going to treat the person as a whole. And when you take the time to go through everything, it allows you to really get to that root cause, and that's when true healing occurs, is when you get to the root cause of what's going on and treat that patient as a whole rather than just looking at their symptoms.
Mm-hmm. And that's something that we've consistently talked about here on the program, is to take a holistic approach, hence Beyond 50 being the title of our show, is go past a halfway approach of looking at things in an integrative whole. And what was interesting is, here in a minute I'd like you to describe really what cancer is, but I remember I was talking with someone who, honestly, I can't even remember if they were a doctor, what it was, but it was somebody we had on the program, and here was something interesting, and I came to this conclusion years and years and years ago, that there's a possibility of an emotional cancer connection, and this was from different modalities, not just people in the healing community, but people, it could be, in the spiritual community, it could be people that came from the philosophical community, whatever the case was, and for me personally, I just seen this emergence that had consistency, saying that there should be a connection between a person's emotional makeup, what their lifestyle is, and getting a disease, for instance, such as cancer. Now, I brought this up to this particular person, and they immediately said, "No, there's no connection whatsoever." And it surprised me, but that's the kind of things that people end up navigating out there, and it's amazing how much that we place our personal power into experts that we believe know better than we do about our particular condition.
Well, I can tell you, Daniel, first of all, I completely disagree with someone saying there's no connection there. I can tell you that I work with cancer every single day, and vast majority of my patients, vast majority, will tell me that they feel that there is a strong emotional connection to their cancer. They will tell me that they feel that the cancer started, 5 years ago or whatever, when their child passed away, or when they got a divorce, or when they lost their job, whatever. There's a stressful event where they felt overwhelmed, and they feel that that's what caused the cancer. And there's more and more research coming out that they might be right. And I don't think that it's crazy at all to think that stress and emotions are linked to cancer. I think that when you look at what causes cancer, in the past, if you talk to a doctor 20 years ago, we all had this idea that everything could be explained by genetics. We all had this kind of this illusion that we could explain every cancer by genetics or maybe a few toxins here and there. But then as we start to understand all these different variables more, we're realizing that it's much more the perfect storm of everything happening at one time. And emotions are a big part of that. And I can tell you that some of the most dramatic experiences that I've witnessed with healing, some of the most dramatic experiences are when it was an emotional blockage that was really resulting in a physical manifestation of cancer. Right. And these are people that would come to my office telling me that they feel that this is very much an emotional disease, even though this physical thing that's showing up on CT scans and MRIs. And when that emotional blockage was dealt with on the energetic level, there was a profound change in how those patients were doing. And I think one other thing, just to kind of hit this point home about how it happens from a biology perspective, is that when you are stressed, and there's no debate about this in the medical community, when you are stressed emotionally, your immune system is weaker. And if your immune system is weaker, then it's going to be less vigilant at detecting these abnormal cells. And if there's more abnormal cells that have the opportunity to grow, then obviously your risk of developing cancer is going to be higher. And when people, a lot of people don't realize this, but this is a very well-documented, well-controlled study. I believe it was the British Journal of Medicine. I can't remember the exact journal, but anyway, it was a very reputable journal. And what they did with these patients was they followed these patients after a melanoma surgery. It's a skin cancer that is removed, and if it's removed, you have a very good prognosis. And in these patients, what they did was they followed people who meditated on a regular basis, and they compared that to people who didn't meditate. The meditation group, they were statistically far less likely to have recurrence of melanoma after the surgery. And that's because when they were more relaxed and they were doing these meditation rituals on a daily basis, their immune systems were stronger. And believe me, if there was a pill that made that much of a difference with melanoma recurrence, you can bet that every single person getting the surgery would be given that pill.
Mm-hmm.
But the great thing about this is that you don't even need a pill. This is something that we're all in control of, and this is a healing connection that every single person can use to promote their own healing.
Now, it's really fascinating. I'd like you to kind of go into what cancer is here in just a second, but you talk about genetics, and it's interesting how we still have the belief system that genetics seems to play a role, excuse me, as though there is a predetermined destiny about how things are going to turn out. You know, in my family, cancer runs in the family. In my family, diabetes runs in the family. And the whole attitude is, since it runs in the family, that we are somehow going to have it run through us as well. And I remember that I had one Dr. Bruce Lipton on the program, who is well known for writing the book Biology of Belief. And somehow that book slid itself into the New Thought community, and it was all about the power of intention and all these other things. And I thought, how many of these people actually read what this guy was talking about here? As this was someone who began to do stem cell research actually back in the 1960s. And like him, I believe there was another one by the name of Dr. Joel Wallach, who was also responsible as well for taking a look at that gene paradigm and saying, well, you know, in the order of genomics, you're not really predestined to anything. There's a possibility, but the fact is, it's really how you live your life that decides on what your genes will actually do. In other words, genes are very adaptable, and, they can kind of go the directions that they will. Kind of give a slight discourse on what your thoughts are on something like that.
Well, yeah, I mean, you're absolutely right, and I've done actually a number of different conferences with Bruce Lipton over the years, and it's interesting because when I started my degree in molecular biology and biochemistry, I kind of got to observe this interesting transition where I started in 2003 or 2004. So when I started my degree, that was when the genome was just sequenced. That's when we just finished sequencing the genome, and there was this mentality that we were going to have all of the answers, everything in biology, that any question we could ever have, we would answer it by this data. And over the course of the 4 or 5 years that I was doing my degree, it became painfully apparent very quickly that that's just not the case, and that these genes that we have, they very much change with the environment. This is called epigenetics, and if you think about it, it's really important for our cells to be able to change and adapt to changing environments. I mean, if you walk outside and it's really hot outside, our cells have to be able to adapt to that. And then if the next day, if it's pouring rain and cold, we have to be able to change to that new environment. Mm-hmm. And if our genes were static and if they were not changing, we would be terrible at changing to these new environments. And so the slightest change in our environment will very powerfully affect our genetics. And this is extremely mainstream molecular biology and genetic concept, is that the environment affects your genetics. And I think that the most powerful part about this, Daniel, that a lot of people tend to forget is the most important part of your environment is how you choose to perceive your environment. How you choose to perceive your environment directly affects your genetics and directly affects your own biochemistry. And when you think about it from this perspective, I mean, your eyes, your ears, your sense of touch, your sense of smell, the purpose of all these sensory organs is to send this information to your brain, which then interprets that information and tells your cells about what type of environment you're in so that your cells can better adapt to that environment. Mm-hmm. And the biggest factor in all that is how you choose to perceive that environment. And that's essentially the mechanism that we can utilize to really stimulate that mind-body connection. And I always tell my patients, don't be afraid to talk to your cells, because your cells are certainly listening to what you have to say.
Hence the biology of belief.
Yeah, absolutely.
And it's really so fascinating, too, as you hear this explained, or maybe perhaps you take the opportunity again to read into this, especially the idea of genetics, that genetics plays this role. It does, but the fact is, as you're saying here, is that you have a greater responsibility to the outcome than you might believe that you did before.
Absolutely, and one other thing that people need to realize, like people tend to get very fearful, saying like, oh, like my mother has Parkinson's and grandmother has Parkinson's, therefore I'm going to get it. Like people tend to focus on these genetic predispositions, thinking that it's set in stone, that there's no way to change that. But what a lot of people don't realize is that every single person on the planet, every single person has literally hundreds of defective or useless genes. We all have them. But the reason that it's not a problem is that our cells have adapted and they've turned off those bad genes that we don't want to use, and they've turned on good ones to compensate for that. There's a lot of redundancy in our cells, and we still don't understand that redundancy, not even a fraction of it. Mm-hmm. And what I mean by redundancy is that you can have 10 or 12 different genes or proteins that do the exact same thing. And just because you're defective in one doesn't mean that you're going to get a pathology. You can have 8 other genes that can actually compensate for the lack of that other gene. Mm-hmm. And people need to keep that in mind. Of course, there are genetic diseases where there isn't that same level of redundancy, and our options are limited. But in many of these diseases where there's dozens of genes that are associated with the development of that disease, there's a lot that you can change. Mm-hmm. And we're only beginning to just understand this. And I firmly believe that if patients are positive and focused, and they're really focusing their energy on stimulating this mind-body connection, I believe that has a powerful effect on the epigenetics, and that's something that every patient should be encouraged to do.
Mm-hmm. Now let's talk about what cancer specifically is. I know there are many different types of cancer, but in the end, to a degree, is it the same?
Well, they are very different.
Okay.
I suppose the similarity between different types of cancer would be that they're all abnormal cells, and they're cells that have gone rogue and they're no longer responding to the signals that your body is sending them. In a nutshell, what happens is that your cells are constantly being damaged. Whether it's by oxygen, whether it's by UV rays, whatever. There's things that are constantly damaging your cells. And our cells are actually remarkably efficient at healing that damage. They're very, very good at repairing this DNA damage. But sometimes what happens is that parts of that DNA get damaged that are responsible for healing the other DNA. And then what happens is you get this accumulation of DNA damage within these cells. And they get progressively more and more abnormal. And eventually you have this cell that is just very metabolically and genetically abnormal. It's going to grow at a fast rate, and it's not going to respond to the signals that it receives from your body to stop growing. And you're right, which is that there's hundreds of different types of cancer, and it really depends on what was the original cell. So, if you have like a liver cell, for example, that turns cancerous, that's going to have different properties than breast cancer or prostate cancer or a cancer from the bone marrow, for example. Every cell has potential to go cancerous, and depending on which cell did go cancerous, you really have to modify your treatment plan accordingly. And that's where you need professional guidance. And this is one thing that I find, really very scary about the internet and how patients look it up themselves, is that I can't even tell you how many times that I've seen patients taking things that are just completely contraindicated or very dangerous with their types of cancer just because they were doing their own internet research and they heard on a blog or someone talking about this supplement's good for cancer.
Right.
And just because it's good for one type of cancer doesn't mean it's good for all types of cancer.
Right.
Every cancer is different. And you really, I can't emphasize this enough, you need professional guidance. And the biggest problem that we face right now is that a lot of medical oncologists will tell their patients, just avoid all natural supplements. Don't take anything natural because it's going to interfere with it. And the truth is that that's not what the research shows. When it's used appropriately, it does make a big difference, and it's a very positive difference. But you have to use the right stuff. And the problem is that because some oncologists are so closed-minded about these things, then what happens is that patients just start doing their own research and taking their own things without even telling them. And that's the worst thing that could happen. These oncologists, they need to form good relationships with naturopathic doctors that can help guide their patients to taking safe and effective treatment plans, not just telling them to avoid everything. And I can tell you that it really depends on the oncologist that a patient has. I mean, I have a good relationship with a number of different oncologists, and then there's others where I'll send them emails saying that this is what we're doing with this patient, and I just won't hear back from them.
Right.
And so it really depends on who you're dealing with. But one thing that I'm very happy about is that there are a number of different medical centers in the States that are starting to have naturopathic doctors work alongside medical doctors, medical oncologists. And the results from that collaboration are phenomenal. And so I really think that just based on the data that we're getting from this collaboration, it's just a matter of time before this is mainstream.
And let me touch on that too. There's very big evidence about this, and I'll tell you why. Sitting there watching television the other night, and this actually goes back probably about 3 or 4 months, all of a sudden there's this cancer treatment center that comes on the air, and they're talking exactly the same way you are about an integrative, evidence-based approach. So we might use the traditional therapies in our clinic, but we're also going to find complementary therapies that will work alongside with this. This is a commercial.
Yeah,
so you know that it's beginning to catch on now.
Absolutely. I mean, it's just kind of getting to this point now where it's getting kind of ridiculous to ignore it.
Right.
They've been working really hard to kind of ignore this and say, oh, there's no evidence, but the evidence is just built to the point that you can't say that anymore. Like, anyone who says that just simply isn't looking at the evidence. No one can actually look at the evidence and come to any other conclusion because the evidence is very consistent and it's very solid.
I'll tell you a funny story. I had a doctor on the program. She's a mainstream medical doctor and practices out of the Southwest. And she was talking about one of her specialties that she's really doing a lot of lecturing now is on oncology and about using natural, holistic approaches to this whole thing, but also saying that perhaps the mainstream ways of doing things also, like what we're talking about here, we're talking about complementary medicine. And, her research is, what causes cancer to grow and what causes cancer to starve to death and die, and it's pretty interesting how she goes about different experiments to see how this works out. I know one of the things she talks about is the fact that cancer thrives on sugar, which we'll talk about here in a minute about these different things. But one of the things that was interesting is she says she was at a lecture where she was, I guess, lecturing to about 150, 200 medical doctors. And it got to the end of this lecture, and all of a sudden they started, asking these questions. In other words, they were asked in such a way as trying to make her look ridiculous, And I'm sure you might have even been in situations like that.
Sure.
And what was funny about the story as she related to me is then all of a sudden this 70-year-old doctor sitting in the front row stood up with his cane, beat it on the chair, got everybody's attention and said, look, what she's talking about here, they were teaching us 40 and 50 years ago. I had to learn it, and damn it, you guys are going to learn it too. And she says the nature of the questioning changed from that of, trying to poo-poo the situation, if you will, to really genuine, sincere curiosity.
Yeah.
And I found that it was a funny story. So
I find it really interesting when you look at the scientific literature. There's been a major shift,
right.
Which is that that doctor's absolutely right. 40, 50 years ago, that's what was taught. People were taught that this is something that you want to, sugar is something that you want to avoid. That after surgery, you want to make sure patients have vitamin C and zinc and vitamin A. Like these are things that are really very well established in the scientific literature. Just because it's an older study doesn't mean that it's invalid. I mean, these are basic nutritional studies that go way back. And what's happened is that it's pretty obvious when you look at the latest studies is that there is a huge bias towards these medications that are very expensive. And it's not due to lack of evidence. It's not that natural therapies have a lack of evidence. It's that there's a bias in the evidence, which is that there's just simply more money going into studies on these expensive drugs. And I find it unfortunate that there seems to be less interest in something if it's not profitable. And there's a lot of very simple, inexpensive natural therapies that absolutely do work in conjunction with these conventional therapies. And kind of just want to touch on one thing that you were saying before with regards to what that medical doctor was saying is that, I agree, which is that this is not a black and white thing where you either do chemotherapy or you do natural supplements. It's not. That's really not what any naturopathic doctor is promoting. It's you have to use all these things together in a synergistic way. If you're doing chemotherapy, if you're doing radiation, that's fine. Let's do things to reduce side effects from that. Let's do things to increase the effectiveness of those therapies. And there's substantial research on these natural therapies that shows that they do just that. And that's really what the focus of my practice is helping to support patients through chemotherapy and radiation. And one thing that I can tell you is that I have many patients who are doing some of the most intense chemotherapy regimens that you can do, and they are having very minimal side effects because they're well supported throughout that process. And when you look at people who are well supported and then you compare it to people who are not well supported, there's a significant difference. Like, you can't deny that these people that are well supported are doing better. And that's what it's all about. If you have the patient that's stronger and if their immune system is able to be more resilient in the face of these aggressive conventional therapies, then that's a huge success. We tend to forget the most basic concept here in cancer, which is that you can do all the chemotherapy and radiation in the world. That will not kill every single cancer cell. At the end of the day, you need a functioning immune system that is able to go in there and clean up the metabolic mess and attack any residual cells that are still there. And that's where I think naturopathic medicine really excels in integrative oncology, which is that there are so many very well-established natural therapies that support the immune system very powerfully. And I've personally witnessed on a number of different times where people are doing chemotherapy and their white blood cell count's going up. And the oncology team was shocked that this is actually happening, that it was an incredible result. And so the bottom line is that these things are available, and people need to be aware that these things exist, and they shouldn't be fearing it.
Now, one thing to be clear about is people will take a look at your book, Integrative Cancer Care. First of all, it's a very enjoyably easy read. And as you lay out what you lay out here, it really makes a lot of sense to think, maybe I should look at more integrative care if you happen to be someone who got such a devastating diagnosis. And as we talked about here earlier, the power of belief has a lot to do with how well you respond, whether you respond well or whether it could take forever. It may not work really as well as it should. And you give an interesting story about two gentlemen as you talk about diet and cancer treatment. Now, first of all, what you talk about through the book is you share three types of mainstream treatments for cancer. There's chemotherapy, radiation, and, of course, surgery. Now, what you do is that with each of these modalities is you show ways that you could support each of these particular types of therapies depending on which one a person pursues and how you can naturally support that as you talk about that evidence-based way of supporting, as you said. It doesn't do any good to get in there and kill cancer cells if you're not going to have good, healthy, strong support of the immune system. But in the beginning, as you go to become treated for cancer, the power of your belief in that has a lot to do with the outcome as well. And you shared a story about two guys who were on two different diets, and the outcomes on that were pretty interesting. Tell us about that.
Yeah, I mean, this is something that really stood out to me very early on in my career as a naturopathic doctor focusing on oncology, where I had these two patients where they both had very different viewpoints on their diet and how that relates to the healing process. I had one who was super strict with his diet. Like he was the strictest diet that I've ever seen, and this person was not responding well to any therapies, and things were progressively getting worse. And then I had this other gentleman at the same time who he was eating all the wrong things. I mean, he had the worst diet possible, but he had no fear of the role that diet plays in the cancer. He really just, it wasn't that he didn't care, it was just that he wasn't fearful of it at all. And that patient who was eating this terrible diet, he was actually responding really well to the therapies. And really the biggest thing that I took home from this is that the worst thing that you can eat is fear. Right. And people need to remember that, is that there's no point in having some super strict diet if you're doing that out of fear. You're eating these foods out of nourishment, because it's nourishment for your heart and soul. You're eating it because it feels like the right thing to do. And you really have to change your relationship with food to make sure that you're not just sticking to a strict diet out of fear. You're eating it, like I said, because it's the right thing to do. And these super strict diets aren't necessarily the most effective treatment plan anyway. You really do need professional guidance to know which diet's really necessary for your type of cancer.
Mm-hmm. Now, let's go ahead and talk about some of the things that you talk about in support. But first of all, there's a myth or two in here that you want to talk about. And here's one I want to bring up right away. Just yesterday, I had a gentleman decide to subscribe to our YouTube channel, which is an area that we like to post our past interviews so people can listen to them at their convenience. So I click on that, and what I like to do sometimes, because I feel that they're interested in our work, is also put them into our Google Plus circles. So I click on that, and I get over to his Google Plus circle, and right away a video pops up that's titled The Alkylene Myth and Hype, the Acid-Alkaline Truth Exposed. And what this particular gentleman who subscribed to our channel did, in fact, his comment was pretty interesting to say the least. It was saying that these two guys are full of BS about alkaline, da-da-da-da-da. There are many videos, now I'm sort of directly quoting this guy, on YouTube that show people who have cured cancer using alkaline water. Now, for many of us who may be familiar with this, we know that that could relate to the fact that all of a sudden there were these water machines being sold for a few $1,000s, that you hear people who were selling these machines saying, you want to raise the alkaline level in your pH because cancer just can't stand that sort of a thing. And in fact, the funniest thing about this, Adam, is this. I was just in a mainstream grocery store about 3 weeks ago, one that I shop at regularly, browsing the shelves. Sure enough, on the shelf, they now sell alkalinized water in bottles.
Yeah, no, I see it all the time, and this is something that I feel like I have a discussion about this almost
regularly. I'll bet. And this, on this video, when you go on YouTube, for those who are interested, just pop up The Alkylene Myth and Hype. It has close to 1 million views. It seems it's split on likes versus dislikes, about half and half. But at least 100+ comments on this whole thing, and it seems more people are supporting what these guys are talking about in the myth than they are saying, now this is nonsense, you can alkalinize your body. But why don't you talk about it as you do in your book?
Well, I mean, this is something, like I said, it's something I talk about quite a bit with my patients, because people hear this on the internet. People hear that, right, by increasing the pH and making your blood more alkaline, that you're going to kill cancer. And this is a classic example of something that makes sense in a petri dish, but it simply just doesn't apply to our bodies. And it's just basic biochemistry why that is. And really, when you look at our blood is what's called buffered, which means that our blood is full, absolutely full, of molecules where their sole purpose is keeping the acidity and the basic nature of our blood exactly the same. There's a very narrow pH range, and our blood doesn't deviate beyond that. And the reason for that is that every enzyme in your blood, like every enzyme, is designed to work at a very specific pH. And if you change that pH, they don't work anymore. So if you were to actually change your pH to that significant of a degree, then you would die. If you actually change your pH significantly like that, your kidneys would fail, your heart would fail, your lungs would fail, and this is really not debatable. That's just the way it is.
Mm-hmm.
And like I said, it's true that when you put cancer cells in a petri dish in an alkaline, environment, they die. But that doesn't mean that we can actually change the pH of our blood to that significant degree. And people kind of have this false perception that if they test their urine or if they test their saliva or their breath, that because that's more basic, they then interpret that as meaning that their blood's more basic. But that's actually not what's happening at all. All that's happening is that your body detects that there's too much basic stuff in your blood, so it pushes it out more aggressively through all your bodily fluids. And so that's all you're seeing is your body just kicking out more alkaline stuff to keep your blood exactly the same. And one thing I think that's important to point out, though, is that when you look at what the alkaline diet actually is, when you take a step back and look at what it is, it's actually a lot of healthy stuff.
Right.
It's, avoiding sugar, avoiding red meat, having more fruits and vegetables. I mean, these are all things that we know to be very healthy. So if you see any positive effects from the alkaline diet, it literally has nothing to do with the pH of your blood, and it's everything to do with the fact that it's just healthy foods.
Right.
And so I would really discourage patients from focusing on the pH of their blood. I think that, personally, I don't think that's healthy at all. I think that, there's no research to support, there really is no research to support the use of alkaline water because you don't want to change the pH of your blood. Mm-hmm. Your blood is at that pH for a reason. And the notion that somehow changing that is a good thing is really not based on any real biological concept at all. Some people argue that if your blood's more acidic, then it's not good for things like osteoporosis. And sure, you could have an argument for that. But are you going to change your pH to a significant degree to actually make a difference with any of those pathologies? No. You can't change your pH significantly. And people really need to realize that this is just a basic biological concept. Your pH cannot change that way.
Mm-hmm. So as you're saying, and you said in the book, is that your body actually regulates your pH really to a degree that no matter what you do, you can't really influence it. It's going to correct itself, in other words.
Absolutely. And if you did change it that much, you'd be dead.
Not good. In fact, I was thinking to myself as somebody actually talked to me about one of these water machines, and I said, I can see that you're passionate and you believe in this stuff, but look, if it's all about alkalinizing water, I'll tell you what I'm going to do. Rather than spending $2,000 or $3,000 on a machine like this, I'm just going to go ahead and go to the store and buy myself, a package of lemons for $5 and alkalize my water that way.
Yeah, there's cheaper ways to do it than several $1,000 alkaline machine. That's for sure. Now,
what's really good about this book too is that you talk about complementary. In other words, you continuously say, use and seek a professional where you can really take a look at the best approach to all of this, and it's very unique and it's very individual. In other words, it's not a one-size-fits-all. But now, there was one thing that I was really interested in that you were talking about, one of the therapies that's used widely in Europe, and that is one of using mistletoe. I never even heard of anything like that before. Tell us about that.
Yeah, I find it really, really interesting that I will talk to patients all the time who are really well researched with integrative cancer care, and often they've never heard of mistletoe. And it's something that is actually very mainstream in Europe. In Germany, for example, I think it's something like almost 80% of oncologists regularly prescribe mistletoe. And this is something that makes a substantial difference in the healing process. And the research behind it is really phenomenal. And, in my opinion, even to call it an alternative therapy, I think is kind of ridiculous. I think that it's as mainstream as you can get. But basically what happens is that you inject these extracts from mistletoe. It's a very specific mistletoe lectin profile where you inject this underneath your skin, and then you get this red reaction. Your immune system gets all excited from the presence of the mistletoe under your skin. And when your immune system gets active there, it's getting active everywhere else. And it's something that really helps to support patients' immune system through chemotherapy and radiation. And one thing that I can tell you that I've observed clinically, just from a sheer clinical perspective here, is that patients look better and they feel better when they do this. And it's a super cost-effective therapy as well. I mean, people automatically assume that, if it's something that you're injecting from Europe, then it's got to be something that's super expensive. No, it's not. I mean, like the cost that I cite my patients is $100 a month. Mm-hmm. And I can tell you that most of my patients, it's actually a lot less than that, where you're injecting this, and it really gets a very good immune stimulation there. And it's something that's very safe to do, and it's something that for people where it's indicated, it's something that they really should be doing that therapy.
Mm-hmm. Now, again, for the listeners out there, that doesn't mean you run out there and you start buying mistletoe and crunching on this thing. Again, what we talk about consistently is work with a medical professional. Beyond 50 is not an internet research tool where you hear something and run off and say, well, I heard this, so I think you should do this. This is about working in conjunction with medical professionals, that really know what they're doing here. So I just wanted to be clear about that. Now, let's talk about, here was really something interesting. Now, we know that sugar just really isn't good for the body, especially if it's somebody who has cancer. And I know about a month or so ago, I actually interviewed someone who wrote a book on how he actually successfully reversed the symptoms of his mother's emphysema. And he was able to achieve this within 17 months. And he was an engineer, and he just went in and began to do the deep research as an engineer does, and realized what I need to do is I need to at least eliminate sugar out of my mother's diet, and at least the foods that can convert to sugar out of her diet. In other words, to starve the pathogens of the cancer cells, because they have apparently, several receptors that are a lot more than the average cell for actually gaining sugar. So the idea was to starve the cell to death by not allowing to have its sugar. Now, you talk about that in the book, about that sugar connection, but it was a little bit different because you were talking about it isn't so much the sugar, but it's really the pancreatic reaction to sugar and how it tones it down that causes that to become a problem for somebody who may have cancer. And I hope exactly. I said that correctly.
No, you did. And,
okay.
And really, I mean, it's a common oversimplification that people use, where people will just simply say that sugar feeds cancer.
Right.
I think that's really where a lot of the controversy comes from, is because that's not technically correct. I mean, yes, sugar feeds cancer, but sugar feeds every cell, and every cell needs sugar. But what the problem is that when you have foods that are rich in simple sugars, those foods like candy and chocolate bars and dried fruit and things.
Processed foods, basically.
Exactly, yeah, processed foods. Things that cause those sudden spikes in your blood sugar. What happens is that when your blood sugar goes really high like that, your pancreas responds by secreting massive amounts of insulin and insulin-like growth factor 1. And when it releases these molecules, that brings your blood sugar down, and that brings it back to kind of the normal level where it's supposed to be. The issue is not so much the sugar. It's that when your pancreas secretes insulin and insulin-like growth factor 1, that's what's really stimulating the growth of these cancers. And that's really what you want to avoid. And the reality is that there's kind of this silly argument that I've heard from medical doctors, actually, where they say, like, yes, I agree with that, and that it's true that the insulin-like growth factor and insulin will trigger the growth of cancer, but then they respond by saying everything has sugar in it, though, so there's no point in changing your diet. And that's just a ridiculous statement that shows just a complete lack of understanding of the mechanism. Mm-hmm. Yes, of course, everything has sugar. If you have a piece of lettuce, yes, there's sugar in that lettuce, but are you going to get a major sugar spike in your blood
right.
from having a piece of lettuce? No, of course not. So it's not so much the quantity of sugar; it's whether that sugar is going to cause those sudden spikes in your blood sugar.
Mm-hmm. Well, and as you talked about, as you eat foods that actually are more natural but perhaps have sugar in them, that the body breaks down and introduces that slow enough into the body's system that it doesn't cause that insulin spike that you were talking about. And so that makes things different than if somebody goes out and guzzles a liter of soda pop, for instance.
Absolutely. Mm-hmm. Yeah, it's a completely different pathway that occurs when you do that. You're not going to have an insulin response from having a salad. You're not going to have a major insulin response from that.
Now, here was an interesting one, and I love what you wrote about in the book because it actually supports another guest that I had a few years back, and she talked with us about the high blood pressure hoax. And what this specific area is that of vitamin E. You know, you want to get your vitamin E supplements in there, you know, because it can help prevent cancer, those kind of things. And then on the next bat, well, you know, we just discovered through scientific research that vitamin E really isn't so good for you. And she said the very same thing on our program that you write about in the book. It's the specific molecule of vitamin E that they're doing the research on. And she says, look, there's a total of some 8 molecules, different things that make up the complete vitamin E. Yeah. And the interesting story that you share in there, I think it was about your grandfather, and you were looking at the supplements they were taking, and you were kind of appalled at how low grade or low quality they were. So if you're thinking about supplementation, you really need to take a look at, well, what grade are you using? For instance, you don't go to the Dollar Tree and buy your vitamins.
Yeah, and the quality really matters. And I think that my grandfather was a good example for that story, because both my grandparents, actually, they're pharmacists. And my grandfather was actually top in his class in pharmacy. And so, you know, it's not like they don't understand these things. It's just that they just didn't really get the training about the difference in quality of these different supplements. And the whole controversy about vitamin E, you know, when you look at the headlines, if you just read simply the headline in the newspaper, they published this all over the place too, where they said that vitamin E is dangerous and it increases the risk of heart attack, and you know, all these you know, very scary statements of things they were saying there. But what it neglects to mention is that they're not actually testing vitamin E. What they're testing is they're testing alpha-tocopherol, which is one molecule of a complex of 8 molecules of vitamin E. Right. And no one was ever saying that alpha-tocopherol was healthy. That really wasn't what people were ever saying. People were always saying that you have to have the combination of all the different molecules together. That's what's healthy. And the research on the true vitamin E, where you're taking all these things together, the research on that is very beneficial. It shows that it does make a big difference as far as cardiac health and everything else. So it really confuses the public by putting out all this misinformation out there. They're very quick to just take one study, make it a headline, and it really, one thing I find really unfortunate about this is that I find even medical doctors at walk-in clinics, they're reading those same headlines, and they don't take the time to go through and actually read the study. And if you did, you would immediately realize that it's a silly study and that they're not even testing vitamin E. They end up then conveying that same information to their patients, and it's just simply not true.
Mm-hmm. Again, it's also fascinating what you see out there, and people tell you, for instance, and again, we've come to a time in our lives that it seems we've surrendered all of our personal power. In other words, you have the power to get out there and research and discover this for yourself. You have the power to ask the right people the right questions to make good informed decisions, which a lot of what you talk about here in the book is exactly the goal. Another thing I would like you to talk about, too, is that of omegas and omega-3s. There's a lot of confusion about that one as well.
Yeah, no, for sure. And when it comes to omega-3s, omega-3s are something that are generally very healthy to take, not even just in the context of cancer. They're something that, they're really something that makes a big difference as far as reducing the risk of cardiovascular events, and it's good for brain health. There's a lot of really very positive benefits from it. One thing I should say as a disclaimer, omega-3s aren't safe for everyone. There are certain drugs that it does interact with. Right. But in people that it's safe to take, it's something that's a very good thing to do. And omega-3s, the dosing really matters. And I see all the time, and honestly, I don't even know how some of these supplements get approved, where I'll see patients taking these pills of fish oil, and I look at the dosing, and the dosing is so minuscule. Like, you would literally have to have the entire bottle to get the therapeutic dosing per day.
Right.
And you have to make sure that you're taking the right amount and that you're taking the right stuff, because there is such a big difference. If you're dealing with something like cancer, for example, that's very inflammatory, that's causing substantial inflammation throughout the entire body, you have to hit that with a reasonable dose of anti-inflammatory natural supplements. Mm-hmm. And if omega-3s are one of those, if you're taking the minuscule dose of that, it's going to do nothing. Mm-hmm. And you have to make sure that you have the right dosing.
Now, fortunately, I live in Portland, Oregon, where we have a naturopathic college, and it's really fascinating because I have interviewed, I believe it was one doctor out of the college itself, and I was asking about supplementation, and how you hear a lot of times that plumbers will tell you, well, that thing just passes through your body. I found plenty of pills in the septic tank, for instance.
Yeah.
And she says, well, the problem is it isn't so much that the supplementation is the problem, but it's the quality, as you've been talking about here. And she says you really want to look for pharmaceutical-grade supplementation. What are your thoughts on something like that?
Absolutely. I completely agree. It has to be pharmaceutical-grade. And I think one big problem that you have in the United States in particular is that there's this, it's actually kind of bizarre where there's no one actually regulating what these natural supplement companies are putting in their pills. Mm-hmm. So just because someone says that there's this amount of vitamin C or this amount of vitamin E or whatever, that doesn't actually even mean that it's in there.
Right.
And it's up to the consumer to do the research and figure out what the best thing is to take. And that's kind of a ridiculous concept in my opinion, because patients don't have time to look all that up.
Right.
And it should be regulated. And I can tell you that in Canada, for example, it's quite strongly regulated. Where if it says that this is what's in the bottle, you can guarantee that's what's in the bottle. And I think that U.S. is going in that direction. They're just a little slow to kind of regulate that. But even at that, you still have to have the right grade, the pharmaceutical grade supplements. And a classic example of this is, especially when you're talking about botanicals. If you're talking about something like, let's just say, astragalus or echinacea, whatever. If there's a botanical, you have to make sure they're using the right part of the plant. Mm-hmm. So you can have companies that can say that there's this amount of weight of echinacea, for example, but they could be using the completely wrong part of the plant. Mm-hmm. And so the therapeutic effect from that would be negligible. And so that's where you need to have a company that has good quality, where you can really trust what the supplement is. And I think that's where naturopathic doctors can be really helpful. They can help patients to kind of navigate all this information and give them a safe and effective plan. And one thing I think is also important to recognize is that you don't have to be taking lots of pills to be healthy. Less is more. And you need to develop just a simple plan that you can maintain for the rest of your life, not something that you're going to do for a 6-week period where you're taking 30 different things. Like that. That's not a good way to balance someone's health. You just have to be on just a few targeted things that are really addressing our therapeutic goals.
And as I like to do, hey, a green smoothie for breakfast never hurt anybody.
And it's simple changes like that make a big difference.
Well, a simple change like that, too, will also change your cravings for taste of different foods that may not be as healthy for you, because it changes your molecular as well as your cellular makeup, because, hey, you're putting stuff in there that's a lot more natural, and so you're not going to be leaning toward more of the produce to manufactured foods. It'll get to a point you just won't even like the taste of it anymore, which is pretty interesting. And I know this really isn't a show about so much supplementation, but, that's an important cornerstone of what we're talking about here in integrative cancer care. And I like the fact that you're showing how, well, look, this is a mainstream approach of how we work with healing the symptoms that are caused by cancer, such as chemotherapy, radiation, and surgery. A lot of times you'll hear people out there just going against that whole thing, saying, well, this is all about money, these things don't really work, or, they can be dangerous. But you're saying, no, if these therapies, since they exist, let's find ways we can support the body, in a very natural way, again, strengthening and having a strong immune system. Back to the emphysema book that I was talking about, that was exactly what his goal was to be sure that he could, as he was changing things in his mom, be able to build and create a very strong immune system. And it was really interesting, just the simple things he was doing, and he became successful over the course of 17 months. And so really fascinating stuff here. There was one more quick point I wanted to make out of your book here that kind of surprised me, because of all the literature that I had sort of seen in the books out there in the 1990s about the miracle of DHEA.
Mm-hmm. Yeah. And DHEA is something that is not safe for everyone. And I have personally witnessed on several occasions where I've had a medical doctor prescribe DHEA to a woman with estrogen-positive breast cancer. and that is the worst thing that you could do. And and they have this argument where if it's 7 keto DHEA, then it doesn't convert to estrogen, and that is true. If you look at the molecular pathway, if it's 7 keto DHEA, it's not actually being converted into any circulating estrogen. But the problem is that that's a real oversimplification of what actually is happening in the body. The estrogen receptors are what are known as promiscuous receptors, and what that means is that they interact with a lot of stuff. A normal receptor, normally receptor A only interacts with molecule A. If molecule B comes along, it's not going to do anything to receptor A. That's not the case with estrogen. A lot of stuff will interact with estrogen receptors and stimulate their activity. So in these patients taking DHEA, especially people with estrogen-positive breast cancers, what's happening is that those receptors are being stimulated. So yes, if you were to test their blood and look at their estrogen levels, it's the same. There's no difference in their estrogen levels. But as far as the cancer is concerned, that doesn't matter. That DHEA is going to be stimulating the growth of those cells. And there are a number of very clear in vitro studies that show that this molecule does stimulate these breast cancer cells. So it's important to recognize that, yes, DHEA is often used for its anti-aging effects because it gives people more energy, it makes people feel more youthful, and I do believe there's a time and a place for that. But taking it long term is not safe for everyone, especially in people who have a predisposition to breast cancer.
Now, finally, what I'd like to touch on, even though we have off and on through the program here, is, again, the idea of a belief system. Do you believe that this treatment pattern is going to heal you? How powerful that belief is going to make a lot of difference on what the outcome is, as well as the support system. There was a time I had a healer on the program when we were talking about sort of the ancient ways, if you will. Back in the day, call them witch doctors or whatever the case may be. But he says, what was really interesting when you take a look at a person in a village who had become ill, and it was the doctor's practice, or what his job was to heal, the first thing he would do is he would get a commitment from the patient themselves. You've got to be all in. I'm not even going to bother with you if you're not all in on this thing.
Yep.
And then the second thing is, would go to his immediate support community. In other words, his family, his friends, those sort of things, relatives. And they had to be all in as well. And if all of these people weren't all in on what he was about to do, he just wouldn't bother doing it. And, you take a look at today when people actually go to a doctor, they sort of separate themselves from their illness. It's sort of like they have this is my car and I'm taking it to the auto mechanic sort of approach to the whole thing.
And
it's like, boy, do we need to change that. What you also talk about is visualizations as well, and how powerful the mind mechanism can be, as you said earlier in the program, for influencing what your cells really want to do and how they want to be. And one or two examples of that, I remember reading about a gentleman who used a visualization where I guess he had a brain cancer, and what he would do is he would picture every day, sometimes up to 2 times a day, rabbits in a carrot field gnawing away at the carrots. And I guess it was after a period of about 3.5 weeks, all of a sudden he simply spat the cancer out, according to the story. And then there was another one I was reading in an autobiography by the late philosopher Alan Watts, where he had a friend who was diagnosed with cancer, and this is sort of what he said in his autobiography. She just simply went out to her garden and let it go. And I thought, wow, pretty powerful stuff there.
Absolutely, and very often with the diagnosis of cancer, people get overwhelmed with everything that's going on, and taking time to do gardening, for example, and just not be worrying about anything in your life for that period of time. That's very healing. It absolutely is, and I think that it's very important that patients can wholeheartedly embrace whatever treatment that they're doing. The challenge that I see all the time with integrative cancer care is you have patients that come in sometimes that they've tried so many different things, but they've never actually given anything a good shot. They do something for a month, and then they change to something else, and they're very indecisive about what they're doing. And you just have to pick a direction, go with what feels right, and you have to stick with it. and you have to be able to embrace that as your answer to this disease. And it's really good to have everyone in the family on the same page as well. It makes a much better healing environment. But I think that visualizations and focused intentions are an excellent way to also get your cells all on the same page and get all your cells embracing that therapy as your answer to the disease.
As we come to the close of the show, I remember it was probably about 11 years ago, 12 years ago, as I was working at another radio station where I was doing interviews such as this. There was a lady who had produced a book where it was about 4 women. Each of them had 4 different religious beliefs, and then each of them were at a different stage of cancer. Stage 1, Stage 2, Stage 3, Stage 4. And as I talked with the lady about the book, she was saying that she had come to the same belief the other 3 women did, as they felt that they were cancer initiates. In other words, they looked at cancer as a special gift that came to them to try to wake them up to the things in life they were really missing out on. It was coming to give them a message. And I know people listening to this would think, well, how does cancer become a gift? But, there are people who actually come through it, and a lot of times that's exactly what they say.
And I hear that all the time.
I'll bet you do.
It sounds crazy to people who don't work with cancer on a regular basis, but when someone has a diagnosis of not just cancer, but any serious disease, it really changes your perspective on life. And for a lot of people, that results in a very positive change in their priorities in life, and they start to focus on things that are really important to them.
The book is Integrative Cancer Care. It's the power of being informed. Our guest today, Dr. Adam McLeod. Is there a website our listeners can find out more about this?
Yeah, the best, probably there's 2 different websites. I mean, there's dreamhealer.com, which is more about the conferences that I do, about focused intentions and how people can use that to promote the healing process. And the other website is my clinic website, which is the easiest link just to say over the radio would be dradam.com.
Very good.
DRADAM.
dradam.com is the website, and dreamhealer.com is the other one as well. There is so much we could have talked about in this book. It would have probably taken us a few hours. But I certainly wanted to touch on the mainstream things that I know from experience people are looking at and talking about out there as a beginning point. It's a fascinating book, and I think the listeners out there will be very encouraged to take a look at this, to begin to open doors and to really look into this a lot more instead of just the hearsay and some of the light research they'll tend to do on the Internet, and begin to just ask good questions to people who can give you good answers. And there's where it all starts.
Yeah, absolutely. And
I was gonna say, it's been a pleasure to have you on the program again, and we'll look forward to the next time that we talk and see just how things are here in the future for everybody.
Absolutely. Thanks for having me on, Daniel.
You bet. We want to thank you, the listeners out there, for tuning in. You can also discover more by visiting us at beyond50radio.com. That is the number 50. Sign up for our free weekly e-news updates as well. You can also follow us on Twitter at Beyond50Radio as well as Facebook. I'm Daniel Davis. Thank you for tuning in, and remember, live your day past